Chapter 13. This is where we really start getting into the more exciting part of pharmacology. And it's exciting to me. I hope it's exciting to you too. But these are drugs that are usually prescription only. You will see them used frequently in the hospital as well as outpatient or people who are picking it up from, say, a Walgreens or a CVS. It's just a little bit more interesting than the basics and vitamins and minerals, in my opinion. So, Chapter 13 discusses the autonomic nervous system and drugs that are used to treat or affect the autonomic nervous system. So the autonomic nervous system is the involuntary part of our nervous system. It controls things we don't even have to think about, like digestion, our cardiac function, as well as our respiratory function. You don't have to think about every time that you take a breath in and out. You do it subconsciously. It's just a natural response. That's the autonomic nervous system. It's divided into two separate parts, the parasympathetic nervous system and the sympathetic nervous system. Those two parts are opposite of each other. Sympathetic is fight and flight, whereas parasympathetic is rest and digest. And so hopefully you can remember those two separately, and they're both part of the same system, but they sort of do opposite things from each other. They balance each other out. So there's 4 different categories of drugs that can be used to affect the autonomic nervous system. The first 2 either block or mimic the sympathetic nervous system. Blocking is adrenergic blockers. Mimicking is the adrenergics. And the other 2 either mimic or block the parasympathetic nervous system. Mimics are cholinergics, and our blockers are cholinergic blockers or anticholinergics. So let's start with our adrenergics, our sympathetic mimic drugs. So the sympathetic nervous system and the adrenergic drugs all kind of do the same thing. They cause cardiac stimulation, increased blood flow, peripheral vasoconstriction, bronchodilation, and dilation of the pupils. So what would that do in real life? Imagine somebody walks into a room and scares the heck out of you. You were sleeping and they wake you up. All of a sudden, your sympathetic nervous system is stimulated, and all of those things that I just mentioned happen. This enables you to move quicker, see better, as well as breathe better in order to get the heck out of there if you need to. It's part of your natural instinct. The neurotransmitter that is released within the sympathetic nervous system includes norepinephrine, epinephrine, and dopamine, and those are the neurotransmitters that help move the impulse from nerve to nerve to get the message to your brain, hey, time to get up, start breathing because you're about to run for a little while. And basically everything just kicks up a notch. So uses of the adrenergic drugs include restoring rhythm and cardiac arrest, elevating blood pressure in shock, constricting capillaries, which can also affect hypotension. It can bring it back to normal blood pressure. Dilating bronchioles in acute asthmatic attacks, bronchospasm, or anaphylactic reaction, such as an EpiPen. And ophthalmic procedures, although that is covered elsewhere. So, side effects of the adrenergics are actually the exact same actions. It's just maybe these things aren't necessarily good. We don't necessarily want them. Just like they can restore rhythms, they can also mess up rhythms if they're, if they're not received properly or overdosed. So cardiac arrhythmias is a side effect. Tachycardia, palpitations, nervousness and tremor, chest pain, hypertension, and hyperglycemia. So these are all things that we expect to happen. They're not necessarily bad or unexpected. They're just side effects. Somebody's not comfortable on my lap today. Precautions and contraindications with adrenergics may apply to patients with pre-existing chest pain, coronary insufficiency, hypertension, cardiac arrhythmias. It's funny, they're used to treat it. It's a side effect. It's a precaution. You can kind of see a trend here. Angle closure glaucoma and hyperthyroidism. So necessarily, if someone were in shock or anaphylactic reaction, it's not that we wouldn't give these medications. We'd just be aware that they could pop up with a cardiac arrhythmia after we've treated their shock or their reaction. So I'm not going to go over interactions because it's really basic. It covers classes of drugs as opposed to specific interactions. If you want to know about specific interactions, what I would recommend doing is when you have a drug, look it up in your nursing drug reference and see what it interacts with. That's the easiest way to find out what your particular drug interacts with. Just because epinephrine interacts with one medication doesn't mean that dopamine is going to do the same thing. Table 13.1 has a list of the adrenergic drugs. It's short and sweet. There's not too many. And you can kind of get an idea of the dosage, the brand name, and what they're used for. Adrenergic blockers. These block the sympathetic nervous system. The most commonly used drugs are alpha and beta blockers. Alpha blockers are covered in chapter 15 and 25. We're going to discuss beta blockers here. Alpha blockers sort of have a different use entirely. Beta blockers are still concerned with more of the autonomic nervous system. So beta blockers are used to block all of that increased crazy reaction. So beta blockers might be used for hypertension, cardiac arrhythmias, chest pain, migraine headache, and tremor. Side effects are the exact opposite of our side effects for our mimic drugs. Side effects include hypotension, bradycardia, which is slow heart rate, fatigue or lethargy, bronchospasm because our bronchioles are closing, nausea, vomiting, hypoglycemia, and confusion. So we would need to be careful with these medications in people who have asthma and COPD. They do the exact opposite of the mimics. They close the airways. So if somebody already has a pre-existing airway condition, we don't want to close the airway even further. Abrupt discontinuation. You never want to abruptly discontinue a beta blocker. That could cause problems, and it's supposed to be tapered down over several weeks. In somebody with diabetes, beta blockers can mask the signs of hypoglycemia, meaning the patient could slip way, way down low and never even have the traditional signs of hypoglycemia, so no one around them might know that they're suffering from it and that they need to be treated. Again, I'm not going to go over interactions. Look up the drug when you come across it to know the specific interactions. Table 13.2 has your list of your prototype, basically, of beta blockers, and all of the other ones pretty much follow that exact, that same class of effects, class of use, so they're very similar. Cholinergics. This is back to our parasympathetic nervous system. Cholinergics mimic the parasympathetic nervous system. The neurotransmitter in this case is acetylcholine, and these drugs can also be called cholinergic drugs. The actions of the cholinergics include increased gastrointestinal peristalsis or movement, increased contraction of the urinary bladder, increased secretions, increased skeletal muscle strength, lowered intraocular pressure, and slowing of the heart. So based on those actions, try to think about what the uses might be. So first, increased gastrointestinal peristalsis. If somebody had a GI tract that was slowing down and needed to keep moving along. Increased contraction of the urinary bladder if someone was having urinary retention and we wanted to get them flowing again. Increased skeletal muscle strength in conditions such as myasthenia gravis where there's muscle weakness. Xerostomia is another use, which is dry mouth. So if the patient has dry mouth, cholinergic drugs can be used to increase secretions. And side effects may include nausea, vomiting, diarrhea, muscle cramps and weakness, slowing of the heart and hypotension, and of course, to be expected, increased secretions can lead to sweating, excessive salivation, tearing, and flushing. In addition, respiratory depression and bronchospasm is another side effect. So atropine is the cholinergic blocker that would be used to reverse a cholinergic crisis or overdose with cholinergic meds. Some precautions and contraindications with the cholinergics apply to people with BPH or benign prostatic hyperplasia because these people already have an enlarging prostate that's blocking urinary function. So if you try to contract the bladder more, it could cause problems because it's constricted. Precautions also exist for patients with asthma, cardiac disorders, or hypothyroidism. So cholinergic blockers, we already talked about atropine. That's a traditional cholinergic blocker. They're also called anticholinergics, are drugs that block the action of the parasympathetic system. And atropine was a classic example that we talked about. So actions of anticholinergics include drying of secretions, so drying everything up, decreased GI and GU motility, so think about a patient who maybe is incontinent and we want to stop them from being incontinent, as well as dilation of the pupils. Uses of the anticholinergics include antispasmodic and antisecretory for GI or GU hypermotility, i.e. our incontinent patients or those with diarrhea or irritable bowel syndrome. Preoperative and pre-anesthetic uses to dry up secretions before someone goes into surgery or during surgery. As an antidote for poisoning or insecticide poisoning, cholinergic crisis, or mushroom poisoning. For the emergency treatment of bradycardia or AV block. For dilation of pupils to diagnose glaucoma, as well as the prevention and treatment of bronchospasm. So, side effects may include blurred vision and headache. Of course, since we're drying everything up, constipation, urinary retention, and dry mouth. It can also cause drowsiness, so falls, delirium, cognitive impairment, especially the older patients, and palpitations and tachycardia. 13.4 has your short list of cholinergic blockers and or anticholinergics. There's many more drugs than that, but it's a good place to start. This chart on or this table on page 225, 13.2, really helpful for figuring out the different drug categories and how the parasympathetic and sympathetic nervous system work. As you can see, I still get tongue-tied sometimes when I'm talking about it. But it's good to know these things. These are very basic, everyday, in-use drugs. You know, we have atropine used frequently in hospice patients who have increased secretions. We have bethanechol or neostigmine, bethanechol being used for patients with urinary retention, neostigmine being used operatively. Beta blockers are so common, you'll probably want to run across one in every patient who's got hypertension. So it's always a good idea to know exactly how these work and why they work. So that covers this week's lectures. Just like week 1, at the end of week 2 is, for the lectures we just covered, is the study guide, and there will be a quiz as well. I hope you guys have a great week, and I'll see you in week 3.